Good morning, everybody. Happy Monday. Thank you so much for tuning in again. If you don't know, I am Dr. Lindsay Ogle. I am a board certified family medicine and obesity medicine physician, and I created this YouTube channel so that I can share my medical knowledge with a wider audience so that more people can live happier and healthier and longer lives. And so, as promised, I decided to make this video about the baseline labs that you may get during your wellness visit. And I use air quotes when I say baseline labs because this is often individualized and is determined based on a provider preference and also the patient's comorbidities or symptoms they may be having at the time of the office. So occasionally this could include more labs, it could include less, and that will be a discussion that you have with your individual doctor. But there are 5 different types of labs that I'm going to touch on today. The first is the complete blood cell count, also known as CBC. And there is a lot of information that comes in this result, but the most common thing that I see that comes abnormal with a CBC is low hemoglobin, which is also known as anemia. And anemia is fairly common in the population, and it can have multiple different underlying sources or underlying causes of anemia. And some of the most common ones are iron deficiency. This is extremely common in women of childbearing age who are having menstrual periods. It can also be due to nutrition deficiencies. And so oftentimes this is seen in people who follow a vegetarian or vegan diet and they may not be consuming as much iron. Vegans are also prone to vitamin B12 deficiency, which can also lead to anemia. So it's really important that they take those supplements. Folate deficiency can cause anemia, and we see this as a nutritional deficiency. It can be common in people who have really restrictive diets or who don't eat very much. Oftentimes, people who drink a lot of alcohol and skip out on food, they can have low folate. There can be genetic causes for anemia. Sickle cell disease, thalassemia are some common ones. There can be GI causes, whether you're not absorbing your nutrients like you should because you have inflammation in your GI tract, or you have maybe a colon polyp that should be seen with a colonoscopy, with that screening colonoscopy that we talked about at a previous video. But colon polyps can sometimes be irritated and can bleed slowly over time, and that can lead to anemia. So again, anemia is the most common thing that I see with a CBC result, and typically will lead to additional lab tests to determine the cause of a person's anemia. The next lab that is typically drawn on at least an annual basis is a complete metabolic panel, or CMP. And the CMP gives us a lot of information. So it lets us know your kidney function and your liver function. And of course, these are very important organs that will detox your body. Important to know that there are a couple of different liver enzymes. There are 2 main liver enzymes that we look at, the ALT and the AST. The ALT is elevated for a few different reasons, and the most common can be hepatitis, so hepatitis B or C, which is often the chronic hepatitis that we see, and it can also be elevated in non-alcoholic fatty liver disease, or NAFLD. And this is a liver condition that is associated with excess body weight, high sugar intake, and we will definitely have a video that talks much more about non-alcoholic fatty liver disease. So if you see that your ALT is elevated, then you want to talk to your doctor about why that is the case. The AST is another liver enzyme that we typically see elevated in people who consume excess alcohol. So if you see that this level is elevated, but the ALT is in a normal range, then it is likely that this is due to excess alcohol, and cutting back on your alcohol intake will help over time. The Complete Metabolic Panel, or the CMP, will also check your electrolytes. And some of the most common electrolytes that can be abnormal are sodium and potassium and calcium. Again, if these are abnormal, we usually repeat to confirm, and then we may require additional blood work or urine studies to determine the cause of the abnormal electrolyte. And then last thing that the CMP will tell us is your blood sugar level. And if you are fasting when you have this lab drawn, then this is a screen for diabetes. And a normal blood sugar, a normal fasting blood sugar is less than 100. And then anywhere from 100 to 125 is in the pre-diabetes range. And if your fasting blood sugar is 126 or above, then that is in the diabetes range. And so definitely something you're going to want to talk to your doctor about if your fasting blood sugar is 100 or greater. The next lab that I want to talk about is a lipid panel. And this is often fasting as well. It doesn't necessarily have to be, but it gives us more accurate numbers if you are fasting when you have this lipid panel drawn. And there are three main things that we look at with the lipid panel. One is the triglycerides. These are the fatty acids that circulate in your bloodstream. This is really impacted by what you have ate or drank before you had the blood draw. Normal triglyceride level is 150 or below. The next portion of the lipid panel that we look at is LDL cholesterol. So the LDL cholesterol is what is often known as the bad cholesterol. And I put air quotes on this because cholesterol in general is a complicated topic that deserves its own video in and of itself, and I will definitely talk about this more. But LDL cholesterol is one that you tend to want to have a lower level, and typically our goal is 100 or less. For most people. Again, I'm going to talk in more specifics about this because it's not a hard and fast rule. Subscribe to this channel so then you will be notified once that video is out and we can go into further detail. The last part of the lipid panel that we really pay attention to is the HDL. So the HDL is known as the healthy cholesterol, and you can remember that because H is the first letter of healthy. So very easy to remember. Since this is a good cholesterol, this is one that you want to have higher levels for. So we typically have a goal for men to have a level of 40 or greater and women to have a level of 50 or greater. So if you see a high number, that is a good thing for this cholesterol level. And so that's it for the cholesterol panel. Again, subscribe and then you will be able to hear much more about how to analyze your own cholesterol panel and determine your risk for heart disease or stroke in the future. Lab number 4 that is typically drawn with a wellness visit is the hemoglobin A1C. It's not always included, and so this can be added based on family history or personal history. Hemoglobin A1C, what that is looking for is it's a diabetes screen. And it is a pretty complicated laboratory test in how it actually works, but it's able to give us an estimate of what your average blood sugar has been over the past 3 months. So it gives us a really good full spectrum picture of what your blood sugar has been doing, not at that time that you have the blood draw, but over the past 3 months. And so if you have a normal A1C, then that's great and you are at low risk for developing diabetes. But if your A1C is between 5.7 and 6.4, that's in the pre-diabetes range. And this is something that you're going to want to address earlier rather than later. And this is another thing that I'm going to have many more videos on in the future. Diabetes is one of my favorite topics to address with patients. It's an area of interest that I have in medicine, and so I will definitely dive deeper into this topic in future videos. And if your A1C is 6.5 or greater, then that is in the diabetes range. A1C sometimes included in annual visits, sometimes it's skipped for various reasons, but you want your A1C to be 5.6 or below. And the last lab that is sometimes included, sometimes not. Again, this often has to do with family history and what symptoms you are having as a patient, but this is the thyroid stimulating hormone, or TSH. And this lab is something that's often asked for patients. They want to know what their thyroid is doing. It's a very common thing that is talked about, especially on social media, thyroid levels. But often it comes back normal unless you're having symptoms or you have a significant family history. So this is why it's not included on everybody's screening labs every single year. It's just not necessary. But a TSH, thyroid stimulating hormone, is checked periodically for most patients, and if you have an abnormal TSH, then it's followed up by additional more specific tests that will tell us what is going on with your thyroid at that time. I will definitely have another video about that. Again, it's a little bit more of a complicated topic that deserves its own dedicated video, so stay tuned for more information about the thyroid. And so that wraps up the typical labs that are done either at your first initial visit with your primary care doctor or at an annual visit with your primary care doctor. If you have any questions about what I covered today, please leave a comment below. I would love to hear from you and love to answer your questions. If there's a topic that you want to know more on, please also comment below. I am happy to answer your questions and address in more detail in a specific video. And I just appreciate you taking the time to listen and learn more so you can apply this to your health, so you can live a happier, healthier, and longer life. Stay tuned to next week. I am going to talk about birth control options for female patients.